Chris from New Hampshire wonders, she or he, I don't know, started fully leasing an 11-year-old paint this spring. For the first 10 minutes or so of warming up, he coughs and sneezes constantly. I had a pony like this. And then he's fine. And if they stop and walk around for a bit and then start working again, coughing and sneezing right back again. So the owner says he's been tested for lots of things, including allergies, and they've all come back with nothing. What do you think?
You had a pony like this. I, right now, have a horse like this. So
Newman.
I know. For the first it was 1 or 2 coughs for like a month. And then it was 3 or 4 coughs for a couple of months. And then it was half the year and a lot of coughing. And it was getting to the point where I was not able to do the work.
It's distracting, if nothing else.
And it didn't feel good to him either, I'm sure. So what I did was I found a board-certified veterinary specialist, internal medicine, and she came to the farm. You can take your horse to a university. And
so you're a vet and you don't treat your horse exclusively?
Oh, because she did some tests that I have not been trained to do because she's a specialist. Yeah,
very cool.
In respiratory medicine. And she was able to do this thing called a bronchoalveolar lavage. Wow. That's a mouthful, so we say BAL.
Okay.
And
lavage means wash.
Yeah, so you flush liquid into the horse's respiratory system. So you see the problem there. Yeah. And then you get it back out and you send it to a lab and they look at it under the microscope and they count and type the cells and diagnose the problem. Now what my horse has, and I suspect this horse has, is inflammatory airway disease.
Oh.
And that is a precursor probably to Heaves or recurrent airway obstruction.
So how are you supporting Newman?
Well, so he gets snuggle puffed every day. Well, now it's
that sounds like a treat.
It is. Now it's every 3rd day, but it actually started twice a day. So I use it.
So it seems like it's working.
It's working great. Okay. But so the snuggle puff is his inhaler with corticosteroids and bronchodilators.
And horse inhaler, not like a people inhaler.
Well, you buy the little people inhaler.
Okay.
But then you have to buy
one.
Yeah, same medication. But then you have to buy a spacer. And the spacer I use fits over one nostril. And then you put the inhaler in this device and you puff. And he gets 8 puffs every 3 days. Wow. And you were joking about treating, but it was right, because when we trained him to allow snuggle puffing, and I call it snuggle puffing because I hold him and I puff, we puff and treat and puff and treat and puff and treat, and now it's puff, puff, treat, and then puff, 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 treat. So we've backed off the treats heavily because he got big.